Today we will discuss about the surgical nerve map of the abdominal wall. Why this topic is matter? Because of the post-operative pain trap. Okay, so we will clarify in this video, inshallah. Okay, so the primary pain traps in hernia repair, appendectomies, and C-section. We have to memorize the nerve map. We can use this 17-1 rule. It explains the distribution of 7 nerves supplying the anterior abdominal wall, thoracic 7 to thoracic 12, and lumbar 1. How it will work and what is the distribution, as we can see in the illustration. We can see in the right side the nerve distribution. Thoracic 7 to thoracic 11, this is the intercostal nerves, and thoracic 12 is the subcostal nerve. We can see lumbar 1, iliohypogastric nerve, and ilioinguinal nerve. On the left side, we can see the arterial supply, intercostal and lumbar arteries, and the anastomosis between the superior epigastric artery and the inferior epigastric artery, which we explained in a previous video for blood supply of the abdominal wall. So let us focus on our target in this video is the nerve pain trap. We can see the double trouble, which is we can see it very common in cesarean section, the iliohypogastric and the ilioinguinal. Iliohypogastric nerve runs between the transversus abdominis and the internal oblique. It supplies the skin above the pubis. Where is the surgical trap here? Often injured in McBurn's incision in appendectomy, leading to weakness in the inguinal canal. It's a common surgical, it's not a common, it's a surgical trap which we can be avoided. Ilioinguinal nerve enters the inguinal canal through the internal oblique. It supplies the skin of scrotum or labia majora according to the gender of the patient and the upper medial thigh. Where is the surgical trap here? This is lumbar 1 nerve caught in mesh or suture during inguinal hernia repair, causing a chronic groin pain. Let us discuss the tab lock. All of us know the tab lock, how it works. It's a surgical insight. When a surgeon performs a tab lock, a transversus abdominal plan block for post-operative pain, they are injecting local anesthesia into the sandwich. Where is the sandwich? To number thoracic 7 until lumbar 1. We can see here in the illustration, the neuromuscular sandwich. Most students struggle with this area, with this layer. Remember, nerves don't run superficial. Nerve is not superficial. They travel in the neurovascular plane like a sandwich. In this area between internal oblique and the transversus abdominis muscle, this is the surgical insight for the tab lock. If you find this video useful, subscribe, like, share this video with your colleague, and follow us for more videos, and you can subscribe for the anatomy course as well.